My name is Julio Santana, and today I will be providing education on a quality improvement project, comparing Remimazolam and Dexmedetomidine for prevention of postoperative cognitive delirium and functional recovery. Thank you, Dr. Hidalgo and Dr. Campbell. Welcome to this educational module on improving postoperative outcomes for elderly surgical patients. In this presentation, we will explore the impact of postoperative cognitive delirium, or POCD, and compare two sedation agents, Remimazolam and Dexmedetomidine, in improving patient recovery and outcomes. By the end of this module, you will be able to 1. Describe the impact of POCD on elderly patients undergoing ambulatory surgery. 2. Compare the efficacy of Remimazolam and Dexmedetomidine in reducing POCD and improving functional recovery. 3. Analyze evidence-based sedation practices to enhance clinical knowledge and improve patient care. Background of the problem. Postoperative cognitive delirium is a significant concern in elderly patients following surgery. Studies indicate that 30 to 41% of elderly patients experience POCD, which can lead to prolonged hospital stays, increased readmission rates, and heightened healthcare costs. POCD also contributes to reduced independence, diminished quality of life, and increased mortality risk. These outcomes are the need for improved sedation practices in perioperative care. Definition of terms. Remimazolam is an ultra-short-acting benzo with faster recovery, fewer cognitive side effects, ideal for quick discharge. Dexmedetomidine is an alpha-2 adrenergic agonist with neuroprotective properties, reduced POCD, and fewer pulmonary issues. The drawback are longer recovery time, hypotension, and bradycardia risks. Postoperative cognitive delirium, or POCD, is a temporary or prolonged reduction in cognitive function that may occur after anesthesia and surgical procedures. Functional recovery. This is a process of a patient returning to preoperative functional levels after surgery and anesthesia. Summary of literature. Research has compared Remimazolam and Dexmedetomidine across various surgical settings. Evidence shows that Remimazolam is associated with faster recovery, better hemodynamic stability, and improved cognitive outcomes compared to Dexmedetomidine. Despite these findings, many studies lack diversity in patient populations and surgical contexts. Future research should broaden these parameters to provide a clearer understanding of each drug's benefits and risks. Intervention and educational module. To address these issues, an educational module was developed for certified registered nurse anesthetists. Training includes key points on the pharmacokinetics, benefits, risks, and clinical applications of both medications. Education among nurses and healthcare providers has shown improved knowledge and skills. Based on literature review findings, Remimazolam is associated with better outcomes in elderly patients undergoing ambulatory surgery. This module emphasizes recognizing the risk factors for POCD, implementing best sedation practices to shorten post-anesthesia care unit stay with faster recovery times using Remimazolam, leveraging evidence-based data to select appropriate agents like Remimazolam or Dexmedetomidine. The goal is to enhance nurse anesthetists' knowledge and improve patient outcomes through informed sedation choices. Adopting these improved practices can lead to reduced rates of POCD by shifting from using Dexmedetomidine to Remimazolam for elderly ambulatory surgery patients based on evidence. Faster functional recovery for elderly patients. Improved perioperative care quality through evidence-based decision-making. By understanding the advantages of Remimazolam and Dexmedetomidine, Nurse anesthetists can tailor their sedation strategies to better meet patient needs. The setting for this quality improvement project will be a large public hospital in Miami, Florida. The focus of this quality improvement project is to educate nurse anesthetists on the administration of Remimazolam and Dexmedetomidine for prevention of post-operative cognitive delirium and improvement of functional recovery. If you are viewing this video, you should have already completed the pre-intervention assessment. Following the presentation, you will be required to complete a post-intervention assessment to evaluate your understanding of the information presented today. Take-home points. 1. POCD is a significant risk for elderly patients, with substantial impacts on recovery and healthcare outcomes. 2. Evidence suggests that Remimazolam offers improved recovery rates and better cognitive outcomes compared to Dexmedetomidine. 3. Educating healthcare providers, particularly CRNA, can enhance sedation practices and improve patient outcomes. In conclusion, by integrating evidence-based sedation practices, we can significantly reduce POCD incidence, improve functional recovery, and enhance overall patient care. Thank you for your time and commitment to advancing patient safety and care quality.